to discuss why the common peroneal component is more vulnerable to injury in comparison to the tibial component, which both are actually a part of the sciatic nerve. So let us discuss one by one the different hypotheses which have been forwarded over the years after a lot of experimental work which was done on animals as well as in the laboratory setup. So, first and foremost is that the common peroneal nerve is more the fibers constituting the common peroneal nerve are relatively more superficially placed in the sciatic nerve than the tibial component. And this is primarily true in the buttock region and in the proximal thigh region. So you can say that the common peroneal nerve is more exposed to the vagaries of trauma, whether it is a misguided injection or it is a bullet passing near the sciatic nerve. If it is in a plane superficial to the sciatic nerve, it is more likely to injure the common peroneal nerve fibers because they are more superficially located than the tibial component. So that is the first reason. The second reason is, which is most relevant for injuries like a posterior dislocation of the hip or a fracture dislocation of the hip or a posterior wall fracture of the acetabulum, where the sciatic nerve is subjected to some sort of a traction injury. So here uh, we must consider the difference in the course of the two nerves and the points of fixity. So if you look at the tibial nerve, if you study the anatomy and the course of the tibial nerve, it is practically vertically downwards. And when it supplies the muscles along the course of its disposition, these nerve fibers or these branches do not provide any fixity to the sciatic nerve. We are here considering the motor branches. So you can look at the muscles which are being supplied, the gastrosoleus muscle, some muscles in the thigh, also the hamstring muscles. These are not, the branching pattern is such that it does not fix the nerve while it is passing in a more or less vertical course right up to the sole of the foot. On the other hand, if you look at the common peroneal nerve, it is obliquely placed in the thigh. At the posterior aspect of the thigh, it follows an oblique course. And particularly when it reaches the head and the neck of the fibula, it is angulated and not only fixed by the overlying soft tissues, but also the motor branching pattern around the fibular neck is such that it creates some sort of a tethering of the nerve. So if you look at the anatomy now, common peroneal nerve is fixed at 2 points. The proximal point of fixity is the greater sciatic notch from which the sciatic nerve is emerging, and distally the fixed point happens to be around the fibular neck, not only because it is winding obliquely, the direction is important, then the overlying soft tissues and the fact that it pierces the peroneus longus and the branching pattern therein also provides a relative fixity of the common peroneal nerve distally. So imagine that a projectile or a fracture occurs in the thigh and it hits the sciatic nerve. The tibial component, because it is fixed only proximally at the greater sciatic nerve, there is no fixed point distally. It gets deflected easily and it suffers less injury than the common peroneal nerve because it is fixed at 2 points, proximally as well as distally at the fibular neck. So any elastic structure which is fixed at 2 points is at a greater risk of damage than if it is if it is lying loosely vertically disposed as the tibial component in the case of a sciatic nerve. So that is one of the prime reasons that common peroneal nerve damage is more common whenever we have a neurological deficit accruing out of a posterior dislocation of the hip or a fracture of the acetabulum posterior fragment with or without dislocation of the hip. I hope this point is clear because this is one of the most important points. Then another point which has been proposed to make the common peroneal nerve more vulnerable is the size, number, and disposition of the funiculi. So the funiculi also are different in the size, number, and disposition in the common peroneal nerve as well as in the tibial component. So if you look at the cross section of a common peroneal nerve, there are fewer but larger bundles with less amount of connective tissue. So the connective tissue which is interposed between the funiculi acts like a packing material. Just like if you have to transport maybe crockery, glass items, then you usually bubble wrap it or you put thermocol packing in between. And this packing prevents the glass items from getting damaged or breakage. So, similarly, the tibial component of the sciatic nerve has more packing in it. The, the fibers are much smaller in cross section. So there are more number of fibers in the same cross section, and there is each around each funiculi there is a connective tissue which acts as a packing material. So it is very easy to imagine that if there are less number of fibers, what happens is the entire amount of stretch or deflection or the force acting on the sciatic nerve gets concentrated onto those large fibers, and since they are fewer in number, they get easily damaged. Whereas in the tibial component, the fibers being smaller in size, they are much more in number. So even if few fibers get damaged, majority of the fibers still are intact and the nerve